Thank you for investing your time here with me today. I am Dr. Shabnam Daskar, a functional medicine doctor. I live in Alberta in Canada. I was in Mumbai for many years, Mumbai in India, practicing as an OBGY until about 8 years. That's a long time. I transitioned to functional medicine full time, so I'm no longer delivering babies or doing surgeries. And functional medicine, for those of you who may not know, is more of a therapeutic lifestyle change. And instead of looking at individual systems, what we do in functional medicine is we look at the whole patient instead of just looking at, your just only your heart, only your brain, because all of them are interconnected. So today's topic is fatty liver, and it is not only about alcohol. Yes, alcohol is important, but that is not the only thing. Now, why has fatty liver become like an epidemic all over the world? Well, we don't know the specific reason, but one of the reasons is fatty liver is actually a part of insulin resistance. So insulin resistance, if you've heard me speak before, you know that what basically happens is it is a problem of metabolism. Your body's carbohydrate insulin system does not function as well as it should. Now, sometimes that can show up as either high insulin or too little insulin. So measuring only fasting insulin will not tell you everything. However, some of the ways in which we can, sort of suspect insulin resistance is if you have excessive belly fat, if you have, a lot of trouble maintaining your body composition, you need extreme exercise, or you have been told that you have fatty liver. Your doctor has done an ultrasonography and said that you have fatty liver, or if you are a woman and you have PCOS, or you had pregnancy diabetes, or you have diabetes now, or you have been told that your blood glucose levels are climbing and you are pre-diabetic, or sometimes it is from some liver enzymes that may be raised. And I'll briefly talk about those. So these are some of the ways in which, or your waist, like I said, belly fat, or your waist to hip ratio is more. So these are some of the ways in which you can suspect. And of course, some of the lab tests like the liver enzymes and your blood glucose and insulin levels are tests that have to be done in a lab. But these tests are available anywhere in the world. Now, the fact is that fatty liver has become very, very common now, and unfortunately, even in children. So one of the reasons is, of course, because it's a part of metabolic syndrome or insulin resistance. So that is the reason all over the world there are more and more people who are either diabetic or they are heading that way, and it is also happening in much younger people. And I come originally from India. India is considered to be the diabetes capital of the world. So by, I think, 2030, they're expecting about 75 million people to have diabetes. And there doesn't seem to be any reduction in the number of people. And even in North America, actually, in Alberta, my small little province of Alberta, every 1 in 5 person is supposed to be pre-diabetic and not know it. So we don't know the exact causes, but we do know that, fatty liver has become a very big problem. And unfortunately, well, at least at present, there is no prescription medication for fatty liver. So what I'm going to talk about today is briefly what is fatty liver and the major concerns about it. But more importantly, I want to focus on what are the things you can do if you have fatty liver and how can you protect your liver? Because like I said, there is no prescription medication for fatty liver. So the treatment is, again, therapeutic lifestyle change. So when it comes to therapeutic lifestyle change, obviously, it's not like, oh, just take a walk for 30 minutes and you'll be good. Your fatty liver will be good. No, it's not. It's a little more nuanced than that. So I'm going to start sharing sharing a PowerPoint. If you've heard me speak before, you know that I cannot do without a PowerPoint. And here I am, slideshow. And after I'm going to try to finish speaking by about maybe half an hour, 45 minutes. And after that, I will open it up for questions. You can either raise your hands and I can unmute you, or you can either type your question in the chat box or in the Q&A. So this is all. So basically, what is fatty liver? Now, it's called by the very medical term of non-alcoholic fatty liver disease. So it's quite often you'll find doctors talking about NAFLD. And in the same breath, they also talk about NASH. So it's usually called NAFLD NASH, and I'll explain what that is. So fatty liver is easier to say rather than non-alcoholic fatty liver disease. So it results from liver damage due to the accumulation of fat, those are triglycerides in the liver, and inflammation in the liver. So these are the two most important, if the only thing you go away from today's webinar is accumulation of fat in the liver and inflammation in the liver, two of those are the major problems. That is actually just the key to the entire presentation. So obviously, if you are going to if you're looking at how to take care of your fatty liver, you will need to address both those areas. Now, the interesting thing is that fat in the liver does not come from dietary fat. It does not come from the fatty food you might be eating. But when I say fatty food you might be eating, as you know that there are different types of fat. There are fat which are good, and there are fat which are extremely harmful. So I will briefly talk about, and if you've heard me speak before, you know some of it already. So number one is, how is fatty liver diagnosed? How will you know if you have fatty liver? The commonest pathway is usually you might have had an annual blood lab test, annual checkup with your doctor, and you have got a bunch of tests done. So these are two, ALT and AST, or SGOT, SGPT, depending on where in the world you are. I wish all over the world they use the same terms and the same units. Well, they don't. So these are two liver enzymes, which in very serious liver disease like hepatitis or drug-induced liver damage, these numbers are very, very high. But if you have mildly raised AST, ALT, your doctor, and of course, along with belly fat and all those other features I mentioned, and rising fasting blood glucose numbers, your doctor will likely do an ultrasound of the whole abdomen and pelvis. So ultrasound of the liver can show fatty liver changes. So these are the commonest ways. Now, AST and ALT sometimes can be minimally raised even in celiac disease. So these are the two main things that need to be ruled out. So usually that is the path you get, or some of you have had an ultrasound done as a part of your annual checkup and a fatty liver shows up. So the next, this thing is your doctor says, oh, you need to make some lifestyle changes to manage your fatty liver better. So the next thing is there is something called the FIB4 score. And if you just Google it, you will find there are lots of calculators. So MDCalc is a good website where you can put in these numbers. So age, of course, AST, ALT, these are the SGOT, SGPT I mentioned earlier. Those are routine lab tests almost anywhere in the world. Platelet count will also come as a part of your checkup. So a CBC will include a platelet count. So you put in those numbers, there is a calculator, and it will come up with a score, which will tell you whether, and it also, most of these calculators come up with an interpretation as well, what you need to do next. So the FIB4 score is again non-invasive. So with existing lab numbers, which you will have anywhere in the world, those are available. That is one way to find out. Next is ultrasound. And also, if you have been told that, the other important thing to remember is 60 to 70% of people who have diabetes have fatty liver. So it is kind of assumed that almost everyone with diabetes will have fatty liver. The last one is FibroScan. That is, again, it's not an invasive test. It's a scanning of the liver, and it's a special machine, which is usually available in hospitals and specialty doctors' clinics, where they can do a scanning of your liver and tell you there are, again, some different scores in that. But the confirmation of a progression of fatty liver is by a liver biopsy. Now, obviously, a liver biopsy is a very invasive procedure, so it is not necessary for everyone to have a liver biopsy unless your doctor looks at your numbers and says that no, your fatty liver is progressing. So just for fatty liver without inflammation, fatty liver biopsy is not necessary, because liver biopsy is invasive and we don't do that so easily. So what are the different stages of liver damage? As you can see here, first is the healthy liver. Now, hepatic steatosis, as I always say, I think in medicine we use difficult sounding terms so that we can sound clever. So steatosis meaning collection of fat. So hepatic is liver, so fat collecting in the liver. The next comes steatohepatitis. So that is the non-alcoholic steatohepatitis is what it is called. Whenever you come across the term itis at the end of a word, you can understand that it means inflammation, and inflammation can occur from various reasons. And the last is liver cirrhosis. And actually, this particular diagram does not have one more stage. From liver cirrhosis, a lot of people can also develop liver cancer. So untreated fatty liver can have serious consequences. But as you can see, until it has moved from a stage of NASH into liver cirrhosis, all of it is reversible. But the fact is, sometimes it's like, number one, it may not be diagnosed early enough, or number two, because the treatment is therapeutic lifestyle change. And as many of you, if you have gone through lifestyle changes, you know the biggest challenge, the holy grail of lifestyle medicine is having people stick to those behavior changes that can help them long term. So this is not like a quick fix. You do something for 3 months and you have this magic supplement or some magic diet or something, and after that you can go back to how you were living before and expect your fatty liver to stay away. No, that usually does not work. So because I'm sorry about that. What happened? So the key drivers of fatty liver disease, this, like I said, this is the key message of the whole webinar, is accumulation of fat or triglycerides in the liver and liver inflammation. These are the two most important things you have to keep in mind. Now, I sometimes, when I'm explaining it to my patients, I describe it as, fatty liver is diabetes of the liver. Now, you can see in this type 2 diabetes continuum that, diabetes is sort of the last event which has happened in a series of things that are going on in many years before. Now, you can see that I have not put a specific timeline here because it varies in different people. In some people, it may happen earlier. In some people, it may happen later. In some people, it may never happen. So polycystic ovarian syndrome in women, pregnancy diabetes, these may show up much earlier than diabetes and fatty liver. And the other important factor, which a lot of people, including doctors, are not aware of, is hypertension. High blood pressure can show up many years before diabetes shows up or fatty liver shows up. Or some of you may have hypertension and fatty liver sort of diagnosed at about the same time. So hypertension is related to insulin resistance, the commonest form of hypertension. There are some secondary hypertension. I'm not going into that. So the commonest form of hypertension is intimately related to your carbohydrate insulin metabolism. So a lot of the time people think that, it's coincidental that diabetes and hypertension are present together in the same person. And I call them the twin evils. But they are actually a similar pathological process in the background. So some of you may have blood hypertension earlier, fatty liver earlier, and a few years down the line, you are diagnosed with diabetes. So it's important to remember. Now, obviously, in functional medicine, we always look at how early can we intervene. So can we intervene even before you develop PCOS if we see that your fasting blood glucose are higher, or you're struggling with belly fat, you are struggling with maintaining your body composition? Because we don't, our first line of treatment is not a potentially toxic medication. It is much easier for us to do our interventions because it is therapeutic lifestyle changes. So who is the high risk fatty liver patient? Someone who has type 2 diabetes, hypertension, and living with obesity. So these are the three most important factors. If along with these you also have fatty liver, then it is time you need to definitely take action. And the interesting thing is, once you make those therapeutic lifestyle changes, your diabetes can get better, your hypertension can get better, and of course you can even lose weight. So one thing is, you will hear very often people talk about, liver cancer and cirrhosis as being the consequences of fatty liver. But most people with fatty liver don't die of cancer and cirrhosis. Most of them die of heart disease and stroke. So when we do an assessment of your risk factors for cardiovascular disease, so cardiovascular disease is the term used to explain heart disease and stroke. So when we do a risk assessment of your risk for cardiovascular disease, fatty liver is one of the factors. Now, as a functional medicine doctor, I have a whole long list of cardiovascular disease risk factors, which I have shared in the past, but maybe I should put it all into one page and share with everyone. There's a lot of it you can see for yourself. Some of these, of course, you need lab numbers. Some need specialized testing, but even without specialized testing, with routine labs and anywhere in the world, you can do a fair assessment. So most important question is, like I said, I want to focus more on what you can do rather than the problem. Yes, the problem is very serious. And for cirrhosis and, for late stage liver disease coming from fatty liver, often the solution is liver transplant. And in fact, a few years ago, I was shocked to find that I come from a small city in India, in Eastern India. And in that small city, I found one hospital was starting a liver transplant program. So that was like, I was shocked to know that that little place also needed a liver transplant program. The transplant program is not a simple thing. So again, I keep harping back to the key drivers of fatty liver disease. So the two key drivers is, one is inflammation and the other one is accumulation of fat or triglycerides in the liver. So where does the fat in the liver come from? Because I've already said it does not come from the fat that you eat. So this is again the second most important slide probably. Is there a special fatty liver diet? Because very often you'll find people searching for fatty liver diet, diabetes diet, this diet, that diet. So the number one goal in fatty liver for treatment is weight loss. And when I talk about weight loss, for your liver fat to go away, for a lot of people, that may mean a very significant weight loss. Now, when I say significant weight loss, usually in medicine, we talk about, sorry about that, 5 to 10% weight loss can be significant. But when it comes to liver fat, few recent studies have shown that a person needs to lose something like 11 to 15 kilograms of body weight. So those of you who are used to pounds, just multiply that by 2.2. So that is about a really large amount of weight needs to be lost for the liver fat to go away. So if the liver fat is not coming from dietary fat, where does most of it come from? So that is where the carbohydrates come in. So if you have found that you do a standard lipid panel and your triglyceride levels are high, triglycerides are actually a much bigger risk factor, even more so in women, than your HDL and LDL, the good or the bad cholesterol. And a few months ago, I did a webinar on cholesterol, and I'm really sorry about that. So triglycerides come from, so you eat more carbohydrate than your body is able to tolerate. And that is a number which is different for different people. So each of you will know that, if your present carbohydrate intake is about, you eat a lot of rice, pasta, bread, things like that. Or in the Indian context, it would be a lot of rice and roti and dosa and idlis. All of those are just starchy food. And a lot of them are predominantly grains. Those can get, so, and you eat a lot of it. And how little you need to eat is different for different people, like I said. For some people, it may be as little as 20 to 50 grams of carbohydrates a day. So a ketogenic diet, I've talked about it before, is less than 20 grams of carbohydrates a day. And that is very little carbohydrates. And for a lot of people who are vegetarians or vegans, that is quite a struggle, because one of your sources of protein, many of you look at beans and lentils. Beans and lentils come with a huge dose of carbohydrates with them. So that is not an easy thing to do. But the starchy food gets converted to triglycerides in your liver and gets stored in the liver. So that is one, the primary goal for you would be to reduce your carbohydrate intake. And like I said, how much can you reduce? That will depend on you. So the things that you should, well, there are no shoulds. The things that you could probably avoid eating are more of rice, pasta, bread, rotis, all these things. And eat proteins, so prioritize proteins first. So when you are planning your plate, and I've talked about this before, serve yourself your protein. Now, if you eat meat and fish and eggs, definitely serve yourself that first, then vegetables, and make sure that you are cooking in high quality fat. And then, on your plate, there is very little space left for carbohydrates at that point. The other interesting thing is, if you eat protein first versus eating carbohydrate first, your metabolic response can be very different. And you can actually see your blood glucose response. So blood glucose is one of the major numbers of metabolism we look at. If you have a home blood glucose monitor, or you're wearing a continuous blood glucose monitor, one of those sensors, you can see your response before a particular food, after a particular food, and just by switching the order of the food. So instead of having, there is a reason why restaurants serve you bread, first of all, because it makes you want to eat more. And obviously the restaurant is interested in having you eat more. So if you can avoid that restaurant, bread, just tell the waiter, I don't want it. Don't even, show up at my table with the bread. And when you're serving yourself food, if you don't serve yourself the bread or the rice or the roti first, and serve yourself protein first, if you compare the same meal eaten in a different order, protein first versus carbohydrate first, and you can check your blood glucose numbers, you will see a dramatic difference. Because protein, and particularly protein when there is good fat added to, let us say, the vegetables, you're enriching it with olive oil or ghee, and that can make your blood glucose levels much more even and lower, versus you start off with bread or rice or roti. That is low carbohydrate food. Now, significant weight loss, one of the things I want to mention, because you've heard me talk about not counting calories, and low calorie diet is probably not one of the best. However, there have been some studies. So this is from the University of Oxford. Dr. Roy Taylor has done some studies where they used a meal replacement. And that was just 800 calorie meal replacement. But because it was a meal replacement, what he found is, so obviously in the meal replacement, they could add all the nutrients. But if you are trying to do an 800 calorie diet with only food, that is not a great diet, because it is depleted from a lot of the nutrients. So a meal replacement shake, which they used, and so this is Dr. Roy Taylor's twin cycle hypothesis is what he calls it. So he says, and he could actually get his patients with diabetes into diabetes remission. So remission meaning remission or reversal. Remission is the medical term we use. Reversal is what most people like to use, is when a person with diabetes who's been on medications is able to stop all the medications and still maintain the blood glucose level. So obviously food has a huge impact. But what he found is if people lost significant weight, so this is like 15 kilograms of weight, that was when the liver in the fat in the liver and the fat in the pancreas went away. Fat in the pancreas you cannot diagnose with just an ultrasound. That needs an MRI, and that is not usually done unless it's in a research setting. So what he found is unless the liver fat and the pancreatic fat went away, diabetes reversal did not happen. So that is why I'm talking about the significant weight loss. And on his program, this was called the Counterbalance program. I know some of you in the audience today are from the UK. So that is something that you can look at. Though his goal was not to treat fatty liver, his goal was to get his patients into diabetes remission. But this is what he found. Now, the other important thing is, fructose containing drinks like, pop, and as you can see from the pictures, so soft drinks, all these that come in bottles, those are the sugar sweetened beverages. Fructose containing drinks are the fruit juices. And even if you make a fruit smoothie at home, see what happens is when you eat the whole fruit, you are also getting all the fiber and everything with it. But when you make it into a smoothie, the fiber is gone. So no, don't drink your fructose is very important, because the problem with fructose is it does not raise blood glucose levels. It does not raise insulin. It directly goes to the liver and causes problems. Next is, of course, alcohol is extremely toxic to the liver. So if you have fatty liver, and obviously you need to know whether alcohol is a problem for you. Some of you may not realize that you actually are a heavy alcohol user. So there are ways for you to check. In my intake question, actually, I have an alcohol questionnaire as well. And I can understand, with the ongoing pandemic, I believe somewhere, I think I read sometime back, that alcohol consumption has gone up by 300%. And that is definitely something that is troublesome. So alcohol may not be a problem for you, then that is not what, but it could be that you're having a lot of fruit juices, thinking that, a lot of people still unfortunately think that a fruit juice is actually a health drink. It is not. Or some of the sugar sweetened beverages, even the ones which are called diet drinks, even those are not really good at all for you. So when I talk about therapeutic lifestyle change, what are the few things I am talking about? Now, if you've heard me speak before, you know that these are the things I talk about. So I have an acronym called SEMMT: sleep, eat, move, mind-body interventions, and targeted supplementation. So I have talked about all of these at different times. Sleep. Are you getting good quality sleep? Not just in terms of duration, but also in terms of, do you feel rested when you wake up in the morning? Remember, the chief goals for a person with fatty liver is reducing inflammation and reducing the fat in the liver, so the triglycerides in the liver. So all these sleep, eat, move, mind-body interventions, targeted supplementations, all of them are, focused on doing that. So this same therapeutic lifestyle change, you could also call it an anti-inflammatory lifestyle. So anti-inflammatory lifestyle is not just food. However, when it comes to fatty liver, the most important component of in this would be food. So eating lower carbohydrate food, eating in a time restricted interval. So that, so time restricted eating is essentially eating in shortened intervals of time. So the most simple way of doing that is you do a 12 hours overnight fast. So let us say you have your supper at about 6:30 p.m. in the evening, and until next morning 6:30 you don't have anything. Don't have anything in the sense you can drink water, you can drink herbal teas, but you don't have milk tea or coffee with cream. Coffee with small amount of cream is still considered a fasting fluid, but basically you get the picture. And the other thing is, if you have early dinner, that makes a huge difference on your metabolism and how your blood glucose levels work out. So early dinner versus late dinner, early dinner, and it also improves your sleep quality. So everything is connected to everything else. Movement is so important. I have talked about movement before. because the nature of our jobs have become very sedentary now. We spend a lot of time sitting continuously. So are you moving enough? Do you use a sit stand desk? A few years ago, I had decided that whenever I have a Zoom meeting or a webinar or anything, I am not going to sit on a chair. And in fact, I have moved the chair away from my home office so that I'm not even tempted to use it. So this is there. Some of these things you may need to make a decision of how you're going to implement that. If you are someone who has a lot of phone calls, one thing you can decide that the moment whenever I get a phone call, I put in my earbuds or earphones, and I'm going to stand up and walk when I'm taking the call, or at least stand if you don't have the option of walking. Walking meetings are one more thing, and uh, in the summer, having a walking meeting in the local park, or if you're in a city like Mumbai, you probably need to go to a mall. So walking in the mall, those are some of the things you can implement. The next is, when I talked about targeted supplements, very often you'll find that, oh, supplements don't work. The fact is, for supplements to work, number one, they have to be at the therapeutic dosage. And supplements don't work in isolation. So two of the commonest supplements that people talk about in terms of fatty liver, one is omega-3 fatty acids, and the next is vitamin E. I'm going to talk a little bit about vitamin D after this slide. So what did they find? You can see they used 4 grams of omega-3 fatty acids. And as you know, omega-3 fatty acids are usually a combination of EPA and DHA. And this was a relatively high dose. So you can see that there was quite a lot of EPA and DHA in it. And they had them taking it for 18 months. So it was not like 1 month and 2 months or anything. Then this is where a lot of the studies sometimes miss out on, is they don't check the levels of omega-3 in the red blood cells. So this particular study, they actually checked the levels of EPA, DHA in red blood cells. This is a test which is available in many parts of the world, in Europe and in North America, definitely. It's a dried blood spot test. So you put you do a finger stick and you put it on dried paper, and you send it off back to the lab and you get a report. If you ask me, this is one of the most important tests I would suggest, so that you know how much of EPA, DHA you need, and how much of omega-3s you have versus omega-3 and omega-6 and trans fats. So trans fats are the worst possible fats for you in the world. For anything, for heart disease, stroke, fatty liver, all of them. Trans fats come from a lot of the factory made goods like cookies and biscuits and all the processed cereals, all those things. So what they found in this study is those who had achieved more than a 2% absolute increase in the DHA levels in their blood had reduction in liver fat. So my point is, if instead of 4 grams, someone was to take like just 1,000 milligrams, so 1 gram, can they expect the same kind of results? Probably not. So what ends up happening? Oh, I've been having these supplements for so long, and I had them for 6 months, it made no difference. The question is, did you have them at the correct dose? So that is extremely important. Now, when it comes to vitamin E, the fact is, if you are looking at vitamin E as something that helps in reducing inflammation, so the anti-inflammatory effects of vitamin E. Now, the fact is, vitamin E is not the only anti-inflammatory nutrient. There are a whole bunch of others. So vitamin E at 800 international units a day, there are studies supporting, showing that that has helped people with fatty liver. But it has not, like, if you don't change food or any of the other lifestyle changes and decide that I'm only going to have vitamin E, that is not enough for most people. And only using 1 or 2 supplements usually does not do everything, because all these processes in the body are interrelated. So if let's say you need 11 different nutrients for a certain process, and you are deficient in all 11, but you have decided to only supplement with 2, Now, obviously, you are not going to get the same kind of results by just supplementing two of the vitamins and minerals instead of using all of them. So that is something I wanted to highlight. So, yes, supplements are important, but the most important thing is to know which ones and how much. So this is actually fairly recent research, and I think I did talk about hormone disrupting chemicals a long time ago. So endocrine disrupting chemicals or hormone disrupting chemicals, EDCs, are a big problem worldwide. So EDCs are related to higher risk for heart disease, stroke, thyroid dysfunction, neurological diseases, metabolism definitely. And where do these EDCs come from? So most of the EDCs are from the numerous, chemicals that are in use today in things like plastics, then in your cans, those all the inner lining of the cans, things like BPA, so bisphenol A. Then there are PCBs, whole bunch of, and some of them have really long names, phthalates, parabens. So some of them can, you may be exposed to these endocrine disrupting chemicals from your house cleaning products. And for women, a lot of it comes from, cosmetics or skincare products. So many of them contain parabens. Phthalates and BPA can come from your food containers, plastic food containers, then non-stick utensils, if you're using them for cooking, that is another source. Then BPA actually, so a few years ago, they decided, okay, there are lots of studies showing that BPA is harmful. So BPA was used in, baby feeding bottles. So what they decided to do is, okay, we are going to get rid of BPA and replace it with something called BPAS. So bisphenol, instead of bisphenol A, it became bisphenol sulfate, I think. But later on, they found studies showed that even bisphenol S was not really safe. So sometimes you have to be very conscious of what you read. If it says BPA free, make sure that it does not have something equally harmful like bisphenol S. So it can technically, it is BPA free, but that does not necessarily make it safe. So one of the best ways is, yes, I know it is convenient to use plastic, water bottles or plastic lunch boxes and things like that instead of glass or stainless steel, because glass, number one, weighs a whole lot more. So if it's like you're packing lunch for your kids, you might consider using stainless steel. Stainless steel does not have endocrine disrupting chemicals, but even the stainless steel container has, often has a plastic lid. So one thing you can do is make sure that the lid does not directly come in contact with the food. Another thing, sometimes it has happened that, I've had to use a plastic container because there was no way out. So what I do is I put the food in a parchment, and, so that the food is not in contact with the plastic. So food is in contact with the parchment. So that is not as harmful as the plastic. And particularly if you're heating that plastic container in the microwave, that is one of the ways dioxins can come out of that. So why are these endocrine disrupting chemicals very serious? Because some of them are hormone mimickers. So my associate, Dr. Natasha Iyer, and I are going to do an event on toxins and heart disease. So February is Heart Disease Month. And I will send a link to that event. And that's a free event. It's going to happen next Wednesday in the afternoon. If you register, you will get a recording. And Dr. Iyer and I have done three other, last week we talked about hormones and the health. So if you're interested in that information, you're going to get links to all those previous previous meetings as well. So those are important hormone disrupting chemicals. So how can you stop using them? See, some of them have leaked into the groundwater, and that is the water we drink. And the unfortunate thing is a lot of the processing of water purification processes cannot take care of all the thousands and thousands of chemicals that we've been dumping into the groundwater. But can you take care of your own exposure to hormone disrupting chemicals? And the unfortunate thing is many of these problems start off even before a person is born. So what they found is they looked at hormone disrupting chemicals in the cord blood. So that is the umbilical cord blood of newborn babies. And they found lots and lots of chemicals which had no business being there. So obviously those chemicals came from the mother. So the mother's exposure to endocrine disrupting chemicals is very serious. And actually, because EDCs are such a big problem, the Endocrine Society has started a big campaign. The World Health Organization has started a campaign. The unfortunate thing is most of these hormone disrupting chemicals are in manufacturing things which are way cheaper. So plastic, a lot of plastic is so cheap. And then the other thing is these plastics and things like that cannot be degraded in even 100 years. So what ends up happening is if they are not recycled, they end up going into landfills, and from landfills, obviously they can get into all sorts of different places and into the groundwater. So going back to one of the good websites for you to check is a website called ewg.org, so Environmental Working Group. They have lists of, for skincare, they have a skin deep database, and you can check your, let us say, your skincare products through that database and see whether they are, the ones you're using are harmful or not. So they have a huge database of a lot of different things. Things like pesticides are also hormone disrupting chemicals. So can you eat either pesticide free food or organic food? And every year they come up with a dirty dozen list. And again, the thing is, yes, organic food costs more, but if you have, like, if you're someone who loves gardening, maybe you can grow some of that stuff yourself and also get, wonderful time in the sun. But that's not an option for everyone, I know. So if you can have at least pesticide free food, that would reduce one area of exposure to EDCs. So that is again extremely important. So this particular theory, where they looked at endocrine disrupting chemicals and fatty liver disease, what they say is this is like a two-hit hypothesis. The first hit comes from all these hormone disrupting chemicals. The second hit is from poor lifestyle and eating a lot of ultra processed food, and that ends up in giving fatty liver to someone. So this is again one more area where you can look at reducing your exposure to hormone disrupting chemicals. Some of these EDCs are like, they're hormone mimickers. So for instance, some of them may mimic an estrogen. So what ends up happening in the body is, in women, for example, instead of the hormone estrogen, the one that is beneficial, connecting with those receptors, so they sort of function like a lock and key mechanism. Instead of the real hormone, connecting with the receptor, what ends up happening is these fake hormones. So these are not really hormones, these EDCs. They are the pretend, let us say the pretend estrogen is sitting there at the receptor. So then what ends up happening is the real estrogen cannot go and connect and start doing all its actions, because the pretender is sitting there occupying that space. And a lot of these EDCs actually are stored in the fat, and some of them are also called obesogens. So they make you store your body fat. So that is the reason EDCs are one of the worst possible things of modern life, and there are thousands and thousands of chemicals. The other big problem is sometimes studying these chemicals is difficult, because number one, you cannot you cannot expose, let us say, a group of children to a whole bunch of these hormones, these EDCs, and not expose another group. That is going to be unethical. So obviously you have to look at what is already going on. The other big problem is, because we are exposed to a huge soup of chemicals, it's not just one or two chemicals. So in that case, sometimes the end result is very different when there are a whole bunch of different ones coming at you together. So reducing your exposure to, so switching your, let us say, your water bottles from plastic bottles to either glass or stainless steel. Yes, I know it is irksome and difficult and all those things, but it is possible to do that. So that is one. Another area is particularly for women. Check your skincare cosmetics, hair color. A few years ago, I gave up coloring my hair. And one of the reasons was, of course, it's so much more convenient. I don't have to worry about, are my roots looking gray or this. I'm fine. I don't have to worry about that. But more importantly, I have reduced one of my major sources of toxic exposure. So that is one big area. Hair straightening products, some of them are very toxic. Another important thing is protect your liver from these major toxins. Pesticides, EDCs, I've talked about. Certain medications can be harmful too, so you need to check with your doctor, and you can actually Google for a lot of these medications. But one thing that really worries me is the poor quality Ayurvedic herbal preparations. So in India, there is a hepatologist, a liver doctor, who routinely posts on Twitter about all the harmful Ayurvedic products that, and his patients are obviously, he's a hepatologist, so he gets very serious patients. Many of them have died because of the Ayurvedic preparations that they have taken. Unfortunately, a lot of these people are not educated, so they don't know of a lot of the harmful effects of these. So my point is, many people think if it is natural and it is Ayurvedic and it comes from India, it must be harmless. Well, my point is, it is not true. Because many of these, and some of these are actually not because of the harmful toxins present in them. It's also what by design is present in them. So some of those, they also have heavy metals in them and a whole bunch of other toxicants. So the liver doctor is what this doctor tweets under, and you can follow him to check all the different products. And a lot of these Ayurvedic products are even from relatively well-known companies, but they are very serious nonetheless. So that is one thing. And in fact, I have made a rule, in the last year or so. If any patient of mine is on some Ayurvedic or herbal or some kind of a product, which I don't know about, either they have to start my treatment after they're done with that, if they don't want to give up those, or they have to actually stop those, because I don't know what is going on with them. And this is the reason, after following his work, I realized that a lot of this is, and a lot of people unfortunately don't realize how harmful some of this stuff can be. So again, summary, what is the thing, all the things that I've been talking about for so long. Fatty liver is a diabetes of the liver, and therapeutic lifestyle change. So anti-inflammatory lifestyle. And the good thing is, it's not going to just improve your fatty liver, it's going to improve your diabetes, your blood glucose levels. You might end up losing weight. It will improve your blood pressure levels. So what ends up happening is you reduce your risk for a whole lot of things, like no early cardiovascular disease, no stroke. All those risks are reduced. Cancer risk is reduced if you use a therapeutic lifestyle change to manage not just your fatty liver, all of health. Don't drink your sugar, eat lower carbohydrate food, and protect your liver from toxins. So that is all. I'm going to stop sharing my screen. And if you have any questions, please raise your hand and I'll unmute you, or feel free to type in the chat box. I'm so sorry about that. I kept on clearing my throat. So far, I don't see any questions, and you will receive a recording of this. Okay. So I have one question. How long do these lifestyle changes have to continue? So this is the challenge. Lifestyle changes have to continue until you achieve the results you're looking for. And usually that is not like 1 month or 2 months. And most importantly, this is the problem with lifestyle changes is, once you stop those changes. So let us say you've started eating lower carbohydrate food. You've started doing intermittent fasting, maybe 12 hours, 14 hours, 16 hours, depending on, and depending on how much support you would need as well. If you have diabetes and you're on medications, I would not recommend you eat lower carbohydrate and TRE without supervision. And it has to be from someone who knows what we are talking about. Not every doctor, not every nutritionist knows about that method. So Once you have done all that and you've seen your fatty liver go away, you lost weight, your blood glucose levels are lower, your blood pressure is better. But if you go back to eating more carbohydrates, you are no longer sleeping well, you have a huge amount of stress in your life, you don't move as much, you're sitting at home, then a lot of those things can be undone very easily. So that is something important to keep in mind. This is not like taking a pill and it's just gets fixed once and it's over and done with. No. But the interesting thing is, for a lot of my patients, what they find is once they've made these changes and felt better, they don't want to go back to the old life of eating, a different way, eating a lot of processed food or any of that, because it's not just your fatty liver, it's like how you feel, how your brain fog is gone, how you are able to exercise more, you're able to do things that you couldn't do before. So no one wants to go back from that. So there is one more question. What foods are the best for EPA and DHA? That's a very good question. Truthfully, you cannot get therapeutic levels of EPA, DHA from any food source only, because the best food sources of omega-3 fatty acids are actually lamb, grass-fed beef, and fish. And fish, it's mostly sea fish. So again, salmon is considered to be one of the best sources of omega-3 fatty acids. And fatty fish, also particularly those that are wild fish versus farm fish. So wild fish are the ones that feed on plankton and all that stuff, whereas farm fish is given, things like corn. Now, corn is omega-6. So farm fish will not have as much of omega-3 as wild fish. But the other problem with a lot of fish in Canada, the recommendation is 2 servings of fish a week because of all the mercury contamination and all of those in fish. In fact, pregnant women are asked to stay away from that because of the contamination. So if you are going to have the recommended 2 servings of fish a week, you are not going to get EPA, DHA, enough EPA, DHA from that. So truthfully, other than supplementation, I don't see anyone getting therapeutic levels. And the other important thing is your body does not have the ability to make omega-3 fatty acids. So that's why they are called essential fatty acids. I hope that answers your question. So food alone will not be enough. You do need to supplement. And how much to supplement? The best is if you can test your levels, that would be the best thing to do. Thank you for that question. That was a good one. Any other questions? Otherwise, I will end the webinar. And actually, March and April, I haven't yet decided what the next few topics are going to be. So you will definitely receive an email with the new list of topics for the next few months. I didn't realize until just a few days ago that after February I have not scheduled any webinar topics as yet. And you will receive an email, and I'm coming up with a brain course. So Tiny Habits for Brain Health. I think I had mentioned before that I said I got myself certified as a Tiny Habits coach because I personally feel that Tiny Habits is the best method for behavior change. But that is something that I have to actually implement and see. So the Tiny Habits brain course is going to come up soon. Thank you very much. Thank you. So thank you for investing your time here with me today, and see you next month. And the other important thing is, if there are any specific topics you want me to discuss, just send an email to my clinic email, and all of you have my clinic email ID, info@drkarmd.com. So info@drkarmd.com. Feel free to send me an email if you have any specific questions. And thank you very much. Bye now.